right. Well, I hope everyone is having a really great day today. We're really excited to be here for our May Technology Office Hours for behavioral health providers. We have a little bit of a light agenda today, so we'll have plenty of time for our community discussion. And so if you haven't joined us for an office hours yet, we usually spend the first half of our time providing some technology updates to the providers that attend, and then we use the second half of the time typically for a provider generated community discussion. We also have a link to submit questions in case you feel comfortable doing that more anonymously. And you can also use the Q&A function or the chat throughout the day today to provide questions. So we won't be taking questions until we get to that community discussion section, but our technology updates are not too long. So we should be able to get there pretty soon. And just we like to, by a show of hands, is if this is your first office hours, we'd love to give you a special shout out. All right. Not seeing any new folks, so everybody here probably familiar with office hours, which is great. We also love returning guests. All right, so I'm going to jump right into it. Today, we're going to start out by just providing a couple of updates on technology system training. We are in the process of looking at our training materials across our products that we have here, our products and technology systems at the BHA. And one of those products is the central registry, which would only be a product that you would use if you're a member of an opioid treatment program staff. So we've created these little cards to kind of give us updates on the different products and projects and systems that we have. So this is our little card for the central registry. So for folks that might not know, just a quick 101 on what the central registry is. It's our automated system to admit and discharge opioid treatment program clients. The users of this system include OTP staff, including admissions intake, front desk, and data and technology teams. So like I said, some recent updates for this product is that our team has been in the process of updating our training materials and our help desk process. So central registry users, every single one of you will be getting an email from us in the next couple of weeks to deliver those updated materials as well as those updated process. But we do have two links here to share with you today, and these are also on the BHA Provider Services webpage on the BHA website. So we will both drop them in chat, but they're always available on the BHA website. And that is our newest version of our training deck that folks can look at anytime, as well as our central registry user guide. And then just wanted to provide an update and a reminder on our help desk and training processes for the central registry system. So for central registry support, you can email just our standard provider support email that's listed here. That email inbox is monitored from 8 a.m. to 5 p.m. Monday through Friday. And we ask that you use the subject line of whatever tool you're interested in. So in this case, you would put central registry in the subject line. And also a reminder to folks that we always offer training and retraining for the central registry. So you can also email that provider support email to schedule or reschedule a training. So just a couple of updates on central registry. And if I have Amanda on, I will hand it over to Amanda to talk with us about CCAR, DRS, and TMS.
Yes, I am on. Awesome. Thanks, Abigail. So hi, everyone. This is in regards to some of the systems that we have that you might be familiar with, CCAR, DRS, and TMS. These are data collection systems for BHA licensed providers. Users include clinicians and other behavioral health staff, including data and technology teams. Similarly to, excuse me, the central registry, you can use the same BHA provider support email for any needs related to these systems. We do ask that you put in the subject line which system you are referring to or that you need help with. Sometimes we'll get emails that just say, you know, I can't get into the system, and we don't know what system you're talking about. So if you can be as specific as possible, that's super helpful. And I think we had mentioned before that we've been kind of working on creating some on-demand training videos, which would include detailed user guides. We are still working on those. It's taking a little bit longer than we expected. So hopefully those will be done in the next month or so. But if you do have any training needs, you can request for a private session via that support email inbox, and we can set something up for you individually or your entire staff, whatever that looks like for training needs at this time. So it is helpful as well when you send that email to make sure you include some available days and times that you would like the training to be. And then lastly, under key resources, often when you need access to some of these systems, like let's say there's a new user at your clinic and they need access to any of those systems, the individual will have to fill out a statement of compliance and a data system access request form. These are now available on the website for ease of access, and this just kind of lists out where you can find them. And then there are also some high-level user guides for CCAR and DACODs, which are on the website. And this is more specifics as into some of like the batch file uploads, but we are working, like I said, on creating some simpler user guides as well. But for reference, those are on the website as well. So more to come.
Thanks, Amanda. So yeah, you might see the new name of the game is the BHA website. So we're trying to be really intentional about aggregating and updating all of our latest training guides there, as well as providing really clear communication about which route to take for which of our systems. So would love to pause and see if there's any feedback or questions on CCAR DRS, TMS training, or central registry training, or any general help desk technology questions or feedback. All right. Well, if you think of any questions, you can for sure put them in the chat and we'll have that community discussion time, but I'll keep us moving. A couple of updates and reminders on, the same topic that we've been talking about, provider technology support and help desk access. So wanted to provide just a reminder that we have our provider BHA technology support email here, and that's been dropped in the chat as well. Like I mentioned before, this email is monitored 8 a.m. to 5 p.m. Monday through Friday. It helps us to kind of know which technology system you're referencing, as we have a couple at the BHA. So make sure that you list central registry, CCAR, TMS, or DRS, depending on what your issue is. And then we encourage you to continue to send responses after hours on weekends, but the expectation is that we'll respond to that next business day that the BHA is open.
Hey, Abigail, I just want to quickly mention too, I know a lot of individuals or providers, maybe you guys got used to having kind of like one point of contact, especially like when Jackie was here and Sharon, and kind of reaching out to people individually, which is great. It's good to have, a person that you can reach out to, but we're really trying to move away from that and streamline it to really reaching out to this one provider support inbox, because when people take time off, we want to make sure that you're helped in a timely manner. So just a reminder in that regard to really try to avoid using personal emails and just go to this provider support inbox.
Thanks, Amanda. That's a great reminder. Yes, and in that vein, we also wanted to publicize some BHA phone support, because I think that people are familiar with this, but just to reiterate, the team that Amanda and I are on BHA's technology team. So we're really well versed in helping you to answer any questions you might have about BHA technology systems. But sometimes we'll get responses in our email, which is totally okay, about things that are held by other teams at the BHA. And some of those teams you can kind of see listed on this new phone tree that the BHA has spun up from their main phone number. So just wanted to point out that this is also a resource in case you have questions that kind of go beyond technology. And these are the folks that would be able to help you out with those questions and coordination. any questions about help desk support, triaging of questions, anything related to this topic before we move on to our community discussion? Okay, no worries. And always a reminder at any time, if you want to give feedback or questions anonymously, you have the Q&A function in the chat, as well as that community question topic form. So whatever to your preference. All right, and so I told you it was kind of a quick agenda today. So we are at the community question portion, and we have a quick quiz or a quick poll, not a quiz. Polls are more fun, it means your opinion, not right or wrong. So I'm going to launch that quick poll, and you'll see it pop up, hopefully on the side of your screen. The poll is asking about, we're trying to think about, as we're doing these standardization processes and really honing in on how best to triage and support behavioral health providers through technology systems. We've heard a good bit of feedback that Google Suite can sometimes be difficult for providers to access because of server firewalls. So wanted to just collect a little bit of data from you all about what your current Google Suite access looks like, and sort of if that has been validated to you by other providers in your network. So if you could just take a couple of minutes, probably will take you no more than a minute to fill out, that would be really helpful to us. And then also, if you have any feedback about Google or any of the tools listed, we would love to hear it from you, either live by coming off mute or in chat as well. Right. And then also just want to say that this is the portion of office hours where folks can come off mute and ask questions about any topic, any kind of technology related topic. So we can open the floor to all of y'all and sort of triage answers here for you as we go. Yeah, Angela, go for it.
I got audio on my phone. Can you hear me?
Yes, we can.
Perfect.
Yep.
Okay. Yeah. Hi, I'm Angela Swafford. I'm from UC Health in a system role, so representing 14 hospitals. We don't do a lot of the reporting you're talking about, but thinking of the similar reporting processes we have for some of the other legally required data elements that go through Google Forms and things like that, as well as like every time the rules are updated and posted on the BHA website. UC Health blocks all Google products. I know there's some, I don't know, I'm guessing it's HIPAA compliant, but I know there's been some concerns with that. So every time like the BHA website has a new document that links to Google, we have to go through IT and submit a formal request to get that specific ID unblocked, and it's really, really tedious. We can't say like, here's the whole page, unblock everything. It has to be each URL. So that's been pretty tedious for us. So I put, yes, we can access it in that poll, but it's with a lot of grunt work involved, if that makes sense.
Are you able, Angela, to access if there's PDFs on the website? Are those accessible?
I think so. If you can send an example, I can check. But I also am in a system role, so I work from home, and if I'm not on the network, I can get to it, or if I use my personal computer, I can get to it. But I know a lot of people like on site at the hospitals have issues. If it's a PDF that links to like if it's a Google document, it would be blocked. But if it's just a PDF like on the BHA hosted site, it would be fine.
Okay, I just want to test it because I've heard similarly, like you've said, a lot of people have issues accessing Google Docs that are on our website. So I know we have tried to make them be more PDFs, but I want to test it out a little bit. So let me find a link and I'll drop it here.
Yeah, that'd be great. And then I'll go on the VPN and check it.
I'll add to that at CCH. We have the same issue. We tried to put the links to the mental health hold forms in our EHR, but our next gen EHR blacklists Google documents the same way. Even though those are PDFs on your website, we can't get to them in our EHR.
Yeah, I want to read, Brian, is your comment about also Google? Because I'll keep to that and then I'll go to the one in chat after that. Okay.
Yes, it's similar to us too. You know, it's a standalone system. If you have a Google ID, you can get on and do whatever you want to do. But when you're trying to get to that from another system, it's kind of got security on it, then I run into the same problems they do. And you know, we have to have Google IDs that are separate from our own corporate IDs. So you know, it's just more of the collaboration with other systems is also a problem for us with the Google Docs. And I'll be glad to do whatever sort of testing you guys want to see what we can and can't do, but just having to have separate IDs is a part of the problem. We've got to have a got to have Gmail account, which we try not to use at all just for security reasons, but we have to have one to get in some of this. So same kind of IT interoperability problems as they're having there too.
Got it. Thanks, Brian. And then Angela and other folks, Amanda did just put in sort of a test document that has that kind of combo PDF Google. So wondering, Angela, if you can, yes, thank you. And Angela, you can drop your result in the chat, though I have a hunch that will not be accessible because I believe that is like a Google PDF link. Cool. All right, and I'm going to read some stuff from chat just so that everybody's able to hear that. Kristen Owens also said we have similar problems with Google Docs at CU School of Medicine. And I believe that was the only other piece of feedback. So thanks everybody, hearing really similar things from the poll that we just put out too. So thanks for that feedback. I have a question in chat that I would like to answer live and also read out to all of you, which is because it's a great question. Are other places struggling with CCARs as they are so time consuming and create a backlog of getting them done and uploaded to the system? What can I share with my staff about why these are so important and where's the data go once it is in the CCAR system? This is a really awesome question. I can answer part of it and maybe look to other folks for whatever I miss. So I will start with answering where does the data go once it is in the CCAR system? And it looks like, oh, thanks for answering that, Amanda. So that data that is collected by CCAR, that is a federally mandated set of data that goes ultimately to SAMHSA. And that data is what allows us to pass through block grant funding to all of the providers that access it. So that is why you fill out CCAR and DACODs, because of your contractual agreements and the requirement from a federal level that data is provided. So that's one explanation you can provide to your workers, is that it is a federal it's a federal compliance for the type of funding that your organization receives. In terms of why it's important, sort of at the most macro level, it helps SAMHSA to really understand our national state of behavioral health, and do things like understand where to allocate funding, as well as how to, change program or like policy enhancements based on that data. So that's at the macro level. I'm curious if anybody else on the call has documentation that they could point to around sort of the importance. I know we have CCAR user manuals that I'm sure kind of highlight that, but anything I missed from anybody else on the BHA side of the call? That's a great question though. Okay. Looks like nothing from anyone else. One of the things that I will include in our follow-ups, as well as in the recorded notes for today, is that little kind of a little description of what CCAR DACODs are used for and why they are important, just to make sure that you have that and you can copy and paste it in like a simple paragraph if that's helpful for your folks. Great question. Sarah, go for it.
Hi, thank you. So I'm from Well Power. I'm the AR manager at Well Power, and I don't know if this is the right forum, but I'm hoping it is. We're really trying to come into compliance with the new Peak Pro BHA Community Services X1, X2 safety net funding approvals, and we are a very large organization, and a lot of people are coming off Medicaid. One of the things that we've asked is it possible for the BHA to offer a training to allow more people from Well Power to become trained on Peak Pro so that we can support a larger community? If we've got 300 people coming off Medicaid, we don't have enough people with the bandwidth to get those applications reapplied. And the other piece to that is it's been really confusing on, it's my understanding that safety net approval is X1. And when we've asked, what do we do for people that are now qualifying for family planning? I'm getting really granular, so please let me know if this is too granular, but we were told, have them apply for BHA community services so that Well Power can receive that back-end funding and they're approved, and then they're getting denied. And so we keep trying to ask the BHA training people for help, and we don't seem to get the right answers. And I've read all the literature and I still don't understand it.
Thanks for that question, Sarah. The first thing I'll ask is if there's anybody on from the BHA side of things that can address that. And if not, I have a contact for you, Sarah, that I'll be able to give you. I'm not the right person to be able to answer those questions because I'm not managing that project, but we can get you to the person who can answer those for sure.
That would be great.
I don't think Justin is on. So yeah, I think we can connect her with Justin, and then Sarah, there should be there should be a way that we can definitely, set up some kind of training in regards to Peak Pro, and can get contacts for that as well. And one other question, you had mentioned something about individuals from BHA that you had tried to be in contact with. Maybe if you can, maybe in that email, I would just be curious if we can kind of determine where that lag was. So I'll reach out to you maybe separately and we can try to pinpoint that.
Yeah, we're trying to ask questions back to the people who did our original training, and I just don't think that they have all that knowledge of how is this supposed to work. And we're hitting the ground running. We're trying to make sure that everyone is getting applied to BHA community services so they can have the Medicaid ID number to put on the new claims.
Okay, yeah, I'll send you a chat just to you, between you and I can get your email and we can follow up with you and Justin. I can loop in Justin. So
all right, thank you so much.
yeah.
So this is Heather, really quickly. When you're saying so we can get their Medicaid ID to put on their new claims, are you speaking to?
So I focus on claims, but I understand there's another set of claims that goes for safety net funding that we send claim data somehow to the BHA.
And that's actually, and that's not the need for that ID is not going to go into effect until July 1 of 2025.
Helpful to know.
Yeah, so that was just announced at a different BHA whatever meeting. But Justin can give you more information. I do not think it's a bad thing. And there is, I think, Justin can give it to you, but if you look under the BHA website, gosh, I'm trying to remember. There's a listing of the Peak Pro trainings that are occurring. Those are actually, HICPUF is actually doing those Peak Pro trainings.
Okay.
So you might want to look there. I know that Abigail gave you Justin's number, but that's where you can find that.
Okay. So. Thank you. Yeah, we're just.
Sorry guys, just to jump in, Abigail. This is Heather,
Hi, Heather. No, yeah, thank you. And I think Heather is correct. So I think that is part of the swirl of this a little bit, is that HICPUF is providing the training. So Peak is their system, not the BHA system. So there's a little bit of that overlap, but Justin will absolutely be able to guide you on the right path. And these are really super questions.
Yeah.
Okay. Thank you so much.
Awesome question, Sarah. Thank you. And thank you, Heather.
Sure.
think there's a couple more that came in if you.
Yeah. Yes, so folks, if you want to follow along in the chat, we're doing some testing on that PDF stuff. But then Jade, I see that your question, how can I get the contract status summary report or similar broken down by month for the fiscal year? So that's something that we can route as a question to our data team. And that I'm not sure if there's a representative from our BHA data team today who maybe can help me talk about routing for that. But if not, I can handle that routing for you. Okie doke. Thanks, Jade. If you could DM me your email, actually, I will get back to you that way if that sounds good. And then Andrew had a question, wondering about OpenPath, which I think, Andrew, you mean OwnPath, and if Medicaid mental health care providers that are not licensed by the BHA can be included in OwnPath. It's a great question, Andrew. I don't think that we have an answer for you on that today in terms of our policy. And I don't think that that is on necessarily like our short-term project plan for OwnPath, but that's something that I can reach out to that team on and maybe get you a date by which that might be something that we are looking at. So we are in the process of making some updates to OwnPath. Yeah, I can add that and have that team come and speak to us next time as well. And Tony, can you say more by I am not licensed and I can get in? Would be great to know.
Yeah, sorry. I'm an HR director and was invited to attend this, and I'm sort of in charge of training all around our agency. I do have a degree in psych. I'm not licensed, but I'm in HR. So I'm able to get in and look at all the courses and do all those things to line them up for other people. So I'm assuming pretty much anybody can get in there at this point and do things, especially I'm looking at a peer training in OwnPath for some of our peers. So I'll be interested to see exactly where the BHA wants to go with this and what's available and how we strategize our training moving forward.
Yes. So Tony, that is a great point. So what you're actually referring to is the learning modules within OwnPath. And that is something that we're actually going to have that team come and speak to us about the differences between the OwnPath learning modules and the OwnPath directory. So I think you are correct in that you don't have to be licensed to participate in those trainings, but that for certain individuals, those trainings are required.
Yes.
But we can get you some more additional information either at next month's office hours when that team presents or just via follow-up email, because that's a great point.
Yeah, great. Thank you.
Yeah, thank you. All righty. Great questions. All right, so Andrew said that in the 24th session, there was ledge that directs BHA to consider consent document management statewide with consumer access. Could you discuss the timeline regarding creating that discussion board for that? Andrew, I am, so I can talk at a super high level. This is not something that I'm able to give you like a direct timeline on, but I know that it's something we're partnering with the Office of eHealth Innovation on. So currently that is my last knowledge of kind of where consent management from a user accessible standpoint is, but don't have kind of any other updates on that, but that's something that we can for sure follow up with you on. Thanks, Andrew. Great question.
I just wanted to circle back regarding the OwnPath in terms of adding other providers to it. I was just able to connect with somebody quickly in a chat, and it is going to be expanded eventually. Right now, it just contains BHA licensed providers, but the team is taking steps to expand it to include other providers as well. So definitely more to come in the coming months regarding that.
Great questions, y'all. What else can we answer for you?
Looks like one more question from Andrew got added here.
I'm not seeing that one.
I can't answer it, but in the 24 session there was.
We went through that one, Amanda.
Oh, you did. I'm so sorry.
No worries.
I was multitasking trying to get the other answer. Sorry.
No worries. Thank you for that. Okay. Well, typically what we do when the conversation slows down a little bit is we say we will stay on the line and continue to answer questions for folks until the top of the hour, but that if you would like to go and enjoy some extra time in your day, you are certainly welcome to do that, knowing that we will keep the recording going as long as we're answering questions. So feel free to stay and keep asking us questions. Feel free to go and, look out for our follow-up email, which usually is delivered a couple of days after office hours. But we will be here chilling if you would like to stay with us. Otherwise, thank you for your time.
Thanks,
Hey,
guys.
Hi, Abigail. I have
Hi.
a question for you. So a couple of people from my agency tried to join the meeting today and they registered, and every time they click on the meeting link, it would just take them back to the registration page. Have you gotten that from anybody else? That feedback?
So Amanda actually had issues logging in today as well. I don't know what that would be because I did it, the way that I always do it, but I will certainly check those
Right.
to make sure. And just so you know, like the registration link will not be the link that actually gives you the link to the Zoom. That will be sent to your email for then you to add to your calendar. So,
Yep. Yep. Yeah, that's exactly the one I'm thinking of.
got it. So that one wasn't triggering. Okay, yeah, let me look into that and make sure. You are able to re-register, and I did a couple of testing this morning where I re-registered and it did send the email back to me with the,
Okay.
but I will check it out because I think something funny is going on. I don't know exactly what it is.
Yeah, if you let me share my screen, I can show you what they were clicking on.
Sure, yeah, let's do that.
Okay. It says I'm not allowed to share.
Oh, okay. It maybe Elizabeth, actually, if you just want to take a screenshot and email it to me, would
Yeah.
maybe be easiest.
Yeah, I'll actually have my coworkers do that. There was 2 of them.
Fabulous.
Thank you.
Great. Thanks, Elizabeth.
Mhm.
Cool. All right, well, maybe last call for questions. Last call before we maybe close out a little early today. And just thank you for your time and your really awesome questions. Thanks, everyone. Have a great rest of your day. Bye-bye.